everyone, you're welcome to my YouTube channel. I can see that a lot of people really enjoyed the previous video and I got a lot of feedbacks and questions, and so that's why on today's episode I will be answering a lot of questions that I got from the previous edition. So stay with me in case you're experiencing poop, diarrhea, constipation, or you've tried all these home remedies and you're still feeling the pain, or you're experiencing heavy bleeding, or probably you skip a period or two. So I'll be talking about some of these things in this edition. Number one question: should I worry about poop or diarrhea or constipation during my period? Okay, so when you have diarrhea or you have constipation during your period, it's not really something to worry about. Remember I talked about a chemical last week, prostaglandin. Yes, exactly, that chemical I talked about that causes menstrual pain. This same chemical, that is prostaglandin, is also able to act on the digestive tract and contract it to be able to push things out. So in these cases, when you experience diarrhea or constipation, you can just follow the normal ways to relieve diarrhea and constipation. I have a video on how to relieve diarrhea and constipation. You can check the description below to the link to those videos, so that if you're experiencing diarrhea or constipation during your period, you can just check out these tips to relieve you of it. Another question is, do I have to worry about every period? Some ladies experience every period such that they have to change their sanitary pads as frequent as possible, and even some go to the extent of using 2 sanitary pads as a result of this heavy flow. Now, heavy flow can be as a result of various reasons. Number one, it can be due to hormonal imbalance. It can also be due to the use of intrauterine device for birth control. It can also be due to bleeding disorders, although heavy flow due to bleeding disorders is one way. But then if you're experiencing heavy flow, I would advise you to see a physician as soon as possible. Another question is pain during ovulation. What do I do when I'm experiencing pain while I'm ovulating, or is it something I need to panic about or worry about? Ovulation is a normal phase in the female menstrual cycle that involves the release of egg from the ovum. Sometimes it's possible for some female or some group of women to experience pain during their ovulation. Pain during ovulation is not something to panic about. In order to relieve yourself of pain during your ovulation, you can follow the same tips I gave for relief of menstrual cramps in the previous video. I'll drop the link in the description below. However, if you experience severe pain during your ovulation, and if this pain lasts for more than 3 days, then it becomes something of concern and something you need to see a physician as soon as possible. It is also important to note that when you're ovulating, it is possible to experience symptoms such as breast enlargement, breast tenderness, or abdominal bloating. So when you have these symptoms during your ovulation, it's not something you really have to panic about. What if I skip a period? Now, in the first few years of starting your period, it's normal for the period to be inconsistent. However, stress, strenuous exercise, some medications, excessive weight loss or weight gain, illnesses, and of course, if you're pregnant, can cause you to skip a period. If you skip 2 periods in a row, it's very important for you to see your medical doctor or a pharmacist so that you can be able to make the proper corrections and then you can have your period back. Finally, what if I've tried a lot of home remedies and I'm still even taking medications to relieve myself of menstrual pain, but then I'm still feeling this menstrual pain? It's important for you to see a medical doctor or a pharmacist as soon as possible. It's not something you should be shy about. They are ready to listen to your complaint and even attend to you, because it might be as a result of infection, it might be as a result of some underlying medical conditions, or it might even be as a result of just a slight hormonal imbalance. So that's why you need to see them as soon as possible to make these corrections. So if you have any other question, you can drop your question in the comment section below. Any question you have, you can drop it in the comment section below, and be sure that I will check them and reply to your questions as soon as possible. And I hope this content was very helpful for you, and if it was, please do well to like the video, and if you have not subscribed to my YouTube channel, do well to hit the subscribe button and hit the notification bell. If you also see the need to share this video to some people that might really be in need of it, please do well to share it to them, and see you next time. Bye.